The measure of intelligence is the ability to change. Albert Einstein said that. And it really fits what we're talking about today. We're doing a deep dive into, well, the future of breast cancer, care screening, diagnosis, treatment, the whole picture. We've dug into some key sources, specifically these centennial editorials in radiology from a couple of top radiologists. Our goal, give you the shortcut, the essentials on these big, sometimes kind of surprising shifts coming our way.
Exactly. And we're going to unpack how things like AI and new ways of imaging aren't just small tweaks. They're really paving the way for a truly personalized approach to breast cancer. We want you to walk away really understanding this revolution that's happening.
Okay, so let's unpack that. You know, you often hear talk about overdiagnosis with breast cancer screening, but I gather maybe the bigger, more critical issue right now is actually underdiagnosis, like missing cancers early enough.
That's spot on.
Yeah.
The real win with early detection isn't just about stopping spread. It's catching cancers before they morph into those tougher treatment-resistant types. And what's really fascinating is this definite move away from the old one-size-fits-all screening.
Yeah.
That's ending.
Yeah.
We're moving to personalized, risk-based approaches.
Right. And this is where it gets, really interesting for me. AI looking at mammograms, it's apparently already doing better than the standard risk models like Tyrer-Cuzick. That's the statistical tool they use, right? And it works well across different ethnic groups, which is huge. And get this, without needing an office visit first. That's wow. Accessibility. And this brings up another point. Liquid biopsies, finding cancer DNA markers in the blood. They're also coming up as a way to flag who needs more intensive imaging. So what this means is those age brackets we use for screening, they'll likely fade away, which lets us screen younger women much more effectively, say 40 to 50. And breast cancer is actually a leading cause of death in that group, surprisingly.
Okay, so if screening changes that much, what about the imaging itself? You're saying mammograms?
Yeah.
They won't be the main tool anymore.
Probably not, no. Because you've got superior functional imaging like MRI coming to the forefront. It gives much clearer diagnostic info, and importantly, without the discomfort of breast compression or needing those big contrast injections.
And connecting that dot, you mentioned something almost sci-fi. Portable MRI, like small, quiet machines.
Yeah, imagine that. Portable, lightweight, quiet MRIs using barely any power, like a toaster. And down the line, maybe even unenhanced MRI techniques could be enough. So even simpler.
Portable MRI like a toaster. It's hard to picture in today's hospitals, but okay, that points to massive accessibility changes.
Yeah.
And treatment's changing too, right? Less progressive.
Definitely. A big de-escalation of overtreatment. Take trials like Prospect that's looking at safely dialing back treatment for some early-stage patients. They're showing how MRI can pinpoint who really just has a single spotted disease. Those patients might get to skip radiation after surgery entirely.
Wow, skipping radiation.
And even more radically, picture this. Maybe traditional surgery gets replaced by minimally invasive ablation techniques guided by imaging. This isn't just tweaking things. It could shift breast cancer into something more like a manageable chronic disease. Think hypertension. You'd use precise imaging to guide treatments, local and systemic, just keeping it under control long term. Less invasive, more living.
It sounds like AI is doing so much here, though, so... Yeah. What about the radiologists? Is their role shrinking or changing?
That's a key question. No, AI won't replace them. Think of it as a super powerful assistant. It speeds up image acquisition, helps interpret huge amounts of data stuff humans might not even see directly. This actually frees up radiologists, lets them focus more on the patient, do these advanced, minimally invasive procedures, maybe even therapies like theranostics.
Theranostics, that's the combined diagnosis and targeted drug delivery, right?
Okay, exactly. Using radioactive drugs for both. So the radiologist's role, it really expands. They're leading trials, shaping guidelines, really owning the interpretation and application of all this data. They become even more central, in a way.
Wow. Okay, that's quite a picture. From tackling underdiagnosis to this personalized, AI-boosted screening and treatments that might just make cancer a chronic thing you manage. It's a huge shift.
It really is. It's a future where we apply what we know much more precisely and maybe question some old assumptions about how cancer care has to be.
Okay, so here's something to chew on, a final thought for you listening. If you could have, say, AI-powered ultrasound on your smartphone, giving you accurate diagnostics right there at home instantly, how does that completely change how we even think about healthcare? When it happens, where it happens? What stands out most to you about this potential future?